Greetings. Greetings. Hi there. My name is Kate Breslin, and I'm the president and CEO of the Schuyler Center for Analysis and Advocacy. We are delighted to welcome you here today for a conversation about the importance of Dyadic Services. And I want to start by, in addition to thanking you all for being here, give a big shout out to our partners in focusing on the health of young children. And in particular, I want to call out HealthySteps, the Klingenstein Philanthropies, Robin Hood, the Children's Agenda, the State Office of Mental Health, New York State Medicaid, and the Department of Health. And I'm always afraid to do this because I know there are more, but I really want to just, top lines really say thank you to our partners who've been partners in this work mostly for many years. So thank you. And a big shout out to our panelists today who will be introduced and who will introduce themselves as we go. And I want to give a moment of celebration for a couple of things that we saw in the New York State budget. This isn't a briefing about the budget, but big excitement about continuous Medicaid coverage for 12 months post-pregnancy, inclusive of immigrant women, whoop, and also some coverage for maternal health services in Medicaid. So some expansion for prenatal and post-pregnancy services that are inclusive of nutrition and other services and Dyadic Services. So we're excited about the rollout of that. It's a great way to start this conversation today where you'll hear from about Dyadic Services from several different perspectives. And so I'm really excited to transition to my colleague, Bridget Walsh, Senior Policy Analyst here at Schuyler Center, to get us going.
Thank you, Kate. As Kate said, I am Bridget Walsh, Senior Policy Analyst here at the Schuyler Center. And we are also joined today by Shannon Mullen, who's a graduate student at SUNY Albany School of Public Health, who's been helping us with this project. Just a couple of things before we get started. Shannon's going to drop into the chat links to the SCAA Dyadic Issues Brief, the fact sheet, and a very new infographic from HealthySteps that outlines their services. Also, at the end of the program, we're going to have a very short survey, so please watch for that in the chat. And we will be taking questions today in the Q&A that's located at the bottom of your screen. So please post in the Q&A at any time. So I'm going to very quickly, we're going to turn this over to our presenters, but I want to give you a little bit of information on them. Our first panelist will be Dr. Laura Jean Shipley. She is Professor of Clinical Pediatrics and Vice Chair for Population and Behavioral Health at Golisano Children's Hospital at the University of Rochester Medical Center. In addition, she is the Associate Medical Director for Maternal Child Health at Accountable Care Partners, URMC's Accountable Care Organization, and is currently focused on championing regional efforts to implement maternal and pediatric population health initiatives that include upstream prevention approaches and behavioral health integration in both practice and community settings. You will also hear from Liz Foley, who is a social worker living in New York City and the mom to 11-month-old Adrian. She has been in the HealthySteps program since giving birth in May 2021. Our next panelist will be Dr. Kenya Malcolm. She is clinical psychologist at the University of Rochester Medical Center. She is the director of infant and early childhood initiatives in the Department of Psychiatry, where she is leading the implementation of HealthySteps at the Golisano Children's Hospital, as well as a program using the reflective parenting curriculum through the behavioral health outpatient service. Kenya is part of the early childhood consultation team with Project Teach, and works with local trainers in providing training related to reflective supervision and consultation to early child care directors across the state. And our final panelist is Donna Bradbury, who serves as the Associate Commissioner in the newly created Office of Prevention and Health Initiatives at the New York State Office of Mental Health. This office is charged with proposing new policy and programs emphasizing primary and secondary prevention efforts for children, youth, and adults, with the goal of advancing a robust and comprehensive prevention agenda. Prior to this role, Donna served as Director of the Division of Integrated Community Services for Children and Families, during which time she led OMH's progressive efforts on infant and early childhood mental health, integration in primary care, and school-based prevention. Before we get to the panelists, I'm just going to take a very few minutes to set the stage for the conversation. New York's healthcare system treats parents and children as separate entities, despite their interdependence. And Medicaid relies on diagnosis to drive reimbursement rather than paying for prevention. This can lead to higher costs, potentially poorer outcomes, and missed opportunities for promotion of positive parent-child interactions, prevention, and early intervention of challenges. These issues are remedied with the dyadic approach that treats the parent and caregiver together with the child. The goal of Dyadic Services is to support families facing adversity while also promoting safe, nurturing relationships for all babies and toddlers. Within the context of primary care, this includes screening babies and toddlers for healthy development and adults for the stressors which impact the well-being of the entire family. If necessary, connections are made to early intervention programs and community-based referrals. And dyadic services are successful. Families treated with dyadic services have better adherence to best practices, as well as vaccination and well child schedules. Dyadic services are available in some areas of New York State, often paid through government grants and private philanthropy. HealthySteps is an evidence-based program of 0 to 3. It's a team-based pediatric primary care program that promotes the health, well-being, and school readiness of babies and toddlers, with an emphasis on families living in low-income communities. The program is currently integrated into 60 practices in New York. Building on HealthySteps, New York City Health and Hospitals 1, 2, 3 impact model spans 3 disciplines. Impact is offered universally to any family with a child under the age of 3 in participating facilities. When it comes to funding for dyadic services, payment policies are important. However, in most instances, Medicaid payment does not flow without a mental health diagnosis. This does not allow for the sustainable funding of programs focused on preventive mental health. Without a payment model conducive to preventive or risk-based dyadic services, providers have limited options to intervene with a billable service prior to diagnosis. Reforming Medicaid to better support these services is not a new concept. It is a continuation of years of work that has already been done to improve health outcomes for all New York families. In fact, New York has already acknowledged the importance of these services through the first 1,000 days on Medicaid. The issue brief and the fact sheet discuss several proposed changes to New York Medicaid that would allow for reimbursement for dyadic services as part of integrated primary care for young children and caregivers. And with that, I am going to turn this over to our first panelist, Dr. Shipley.
Thank you so much, Bridget. Can you hear me okay?
Yes.
Excellent. Okay. So good afternoon, everyone. My name is Laura Jean Shipley, but I am known to most people as LJ. I carry some fun and slightly wordy titles now, as Bridget introduced me. And as I'm working with my colleagues in our area in Rochester and the Finger Lakes region to really improve maternal and child health partnerships and approaches in our region. But I have to say my identity at my core is that I am really a primary care pediatrician, and it is the title that I carry most proudly. So as part of this dialogue today, I'm going to offer my perspective on the role of the primary care provider when it comes to working with newborns, parents, and families with young children. I'll start by saying that One of my very favorite repeated experiences in primary care practice is the joy of meeting with a family who is about to or has just welcomed a new child into their family and saying to them, this is a journey and a partnership. I will walk this with you. I will be there with you. I won't have all the answers or be able to anticipate all of your questions, but we will figure things out together and do it as a team. My other really most favorite thing in being a primary care pediatrician is holding the babies and the young children. So I'm just going to acknowledge it right here. I am a baby hugger. I used to sneak into the intensive care nursery when on call, and I would feed those little babies at night. And the nurses always knew where they could find me. But in all honesty, this is what we're here to talk about, right? There is nothing that is more grounding, awesome, or profound than holding a newborn baby who is not your own and looking into their eyes, having their fingers tighten around your finger, and then looking up and back into the eyes of their family unit and thinking, wow, and then saying, I am all in. Let's go. So where is it that we go? I want to just let you know, like, what is a typical visit with your child's primary care doctor or nurse practitioner? It's divided up into 4 major areas, and Bridget highlighted these a little bit, but the first part is answering the questions that the family brings, and in turn, engaging them in screening and questions that we do to assure a family and child have what they need and that no changes have occurred for them in terms of a safe home environment, access to nutrition and childcare, transportation, health insurance. The next part is a complete physical exam where there's great attention paid to growth and waking, and to developmental progress that can be observed in terms of muscle strength, coordination, verbal, and social interaction. The third part is preventive vaccinations and lab tests to assure we're keeping that child safe from preventable disease and environmental risks, risks like early identification of lead in a child's environment. And then fourth, what we call anticipatory guidance. And that's really that time where you talk to a family about what they can expect next in the next upcoming months before they come back to see you again, because we actually see a lot of each other in the first couple of years of life. You're trying to help prepare them for changes in developmental progress, nutritional needs, behaviors, sleep, and what the family can do to anticipate, prepare, and support those changes. Some of that preparation is done in conversation with the family during the time of the visit. Some of it's through handouts or web references. And that's a lot. That is before, as a pediatrician or as a family physician, nurse practitioner, you walk into a well child visit, you are thinking, okay, we're going to do all those things. And that doesn't include the sudden change in direction that happens when things are not all going according to plan. When your screenings reveal postpartum depression, or developmental delays, or new social determinants of health risks, or there's a clinical finding that was unexpected and that requires evaluation or referral, or multiple things requiring attention right now, all at once. And it's a lot, especially if you have to do that all alone. So I'm going to date myself a little bit, but I've been in primary care practice for 25 years. And so many times over my 25 years in practice, I found my internal quiet voice and then my external not so quiet voice repeating, I wish I had more time. I wish I knew more about community resources. I wish it was easy to connect with this mom's OB or midwife so I can understand what was happening during the pregnancy or what's already been done. I'm not sure what to do here. I cannot do this alone. I need a team. And I wish insurance would cover it and that our system was different. So it would be really fun at this point to say that there is a maternal child health fairy godmother who waved a magic wand to make my wishes come true. But that would not be fair or true, because that would fail to recognize all of the tremendous efforts of so many who have worked for so many years to achieve change in this system of care. But I am just so excited that we're here talking about changes that have happened, that are happening, and what could come, and really thinking about what more we can and need to be doing for pregnant women, parents, babies, children, and their families. because things are changing. And I think they are poised to get even better. But I have to just say, and I hope that we come back around to this in this session, other sessions, we need to work more towards Medicaid reform that will support this critically important work. And not enough is being done and not enough attention is being paid to it yet. But I thank you to all of you who've worked so hard to get us to the point that we are with some of these changes. So in wrapping up my part of this, I will just say to you that healthcare is becoming a team sport. Thank goodness. We are all learning to partner better with each other, but we need to make it even more so. Like this should be like an Olympic level sport. And we need to assure that the systems of payment support all of the critical components of that team. We are breaking down barriers that silo our services in exciting ways. We are developing interprofessional care management teams of nurses and social workers, behavioral health specialists, lactation specialists, community health navigators, all working together with health practices and with our colleagues in the community to support the full care of pregnant women, babies, and families. At the same time, while we're adding services, great services that you're going to hear more about today, like the HealthySteps model, like the 3-2-1 impact model. While we bring services into practice settings, we need to better connect with those experts who are providing services throughout the community. And that is just equally as important. For example, in that line, we need to advocate for and connect with the critically important home visitation programs and community supports who provide targeted services for pregnant moms and families. And I would say in a really important way, we are beginning to address the divide between maternal and infant health and address that connection between a baby and child's whole health, meaning their physical, mental, and environmental health, and that of their parents, caregivers, and families through programs like HealthySteps, the model that you'll hear more about today. And I think most importantly, and here's the piece that I would say I just want to call attention to, I think we are changing the way we do business more in healthcare. I started out by saying to you, one of my favorite things is the fact that as a primary care doctor, you engage in a partnership with the family. You don't just get to run the whole show. Like they really are the parents and the family of a child, but you're an important partner in that space and they are leading this with you. I don't think we do that in healthcare. We haven't traditionally. And so finally, I think our health systems are stopping to take time and listen to and engage with patients, with families, with communities, so we better understand their lived experience and we create new effective approaches and solutions together with them as partners. And to that end, it's my pleasure to turn to Liz Foley and her beautiful son, Adrian, for Liz to talk about her experiences as a parent in a practice that has implemented the HealthySteps model. Liz, I'm going to switch to you and ask if you'd like to introduce yourself, and then I have a few questions I'd love to ask you.
Yes. So I'm Liz, this is Adrian. We live in NYC, and we've been part of HealthySteps since he was born. He's about 11 and a half months now, so it's been almost a year that we've been in the program.
We are so happy to have you here today. And it's just, I love watching people on the screen. You can't see the rest of the people on the webinar, obviously, but every time Adrian looks up and makes eye contact, everybody just smiles and lights up as they see him. So Liz, I was wondering if you would be willing to talk to us a little bit about what it's like bringing your child in for a doctor's visit and seeing your child's pediatrician and your HealthySteps specialist.
Sure. Well, something that I really liked is from the very beginning, it was just folded in as part of normal care. So, I saw the pediatrician. She's fantastic. I love her. And she's someone who was recommended by a friend of mine in the community. And she said, okay, well, now you've spoken to me. You're going to speak to our development specialist, Tara. She's going to be here to answer your questions, all that sort of thing. So it was always a part of everything from the beginning. And, my pediatrician is great and will get back to me, but I know just logistically it's hard for her to be available to answer questions on the go. And Tara, our HealthySteps specialist, has made herself available from the beginning by text and all sorts of things to answer questions, which we had a lot of in the very beginning. I'm a first-time parent, and she was extremely helpful around that, especially. And let's see, I made some notes because he's been up teething and I didn't want to miss anything important. Yeah, and she, you know, she makes great notes. She remembers any challenges that we were having and checks in with them about us regularly after all of our visits, whether it's been in person or sometimes by phone because of COVID and scheduling stuff like that. And then now she's also running a group. So I'm in a parents group that she runs, which has been really nice because I think a lot of us, especially new parents, are sort of wanting for a little community in these times, especially when we're trying to be cautious and stay at home. And you're eating my pen. That's not good. I'm trying to give him various things to distract him.
Sorry, I realized I had myself on mute. I was starting to ask you another question. So it's so exciting to hear about the way that the HealthySteps specialist is sort of just folded in, is really just part of your healthcare team. I wonder if, can you talk a little bit more about any other types of things that you talk about with the HealthySteps specialist, or maybe talk a little more about the parent group?
Want this for a little bit? Okay. So I would say the two things that came to mind immediately are, first off, we had some sleeping issues and we keep checking in with her about that. And I remember like one day we woke up and he started sleeping in a weird position, I think right around when he was 4 months, you know, where he was sort of starting to roll, but not rolling that much. And I was just like, is this normal? Like, this is concerning. We're trying to do everything right with putting him on his back and the flat and the no blankets and all that. So I texted Tara and she was like, first off, I think that's fine. But also I'm going to check in with the pediatrician as well, just so we can feel really comfortable that like this is safe. I can catch her in between appointments and I'll get back to you. And so like she comforted me then, and then I got like the extra, the pediatrician said, oh yeah, he's gonna, you know, he's gonna do some weird stuff while he's transitioning. It's fine, no worries. And then a longer term issue was, you know, I had a lot of challenges, especially at the beginning with nursing. And I've never been able, you know, it was supply issues actually. So his latch was good, but I just, you know, wasn't able to give him everything he needed from the beginning. And, you know, when we went for an initial checkup, he had like lost some weight because it turned, you know, it's hard to tell what they're getting in the beginning. Again, I had never had a baby before. So it's like, I was hoping he was getting enough. And I was really discouraged about it. And, you know, she put me in contact with a lactation specialist, which was great in terms of kind of the logistical piece of like what to do and is he latching and, you know, positioning and all that sort of thing, what I can do like physiologically to help produce milk better. But Tara was really there for me around like the emotional piece and setting goals for what we needed to do. And she really helped me understand that like it wasn't an all or nothing thing. Because you sort of, they talk about breastfeeding, like, are you going to breastfeed? Yes. And like the whole time through my pregnancy, I was like, yes, like I'm going to do it. Nothing but it. I can't wait to make it happen. And I was just so disappointed that I couldn't do that solely. And I felt really bad about it. And I think if I hadn't had that extra support of her talking to me regularly and saying like, no, that's great. Like if your husband is using formula sometime in the night so you can get some sleep, I think that's going to help with your milk and you're going to be a better mom. And like, you know, we ended up, and to this day, we're still doing both. And it's great. Like, I know a lot of moms who were able to solely breastfeed, who for one reason or another, their babies didn't want to do it after 6 months. And he still wants to all the time. So it's great. It's really nice for us. We bond. And then also, like, I am using formula to get through it. And like, I really, in all the stuff I read and the preparations I did, was just not aware of that gray area where we could exist. And it was like, you know, my husband's very kind, but he doesn't know a lot about it. And she was really a person who gave me a lot of support and encouragement during that, which really meant a lot. And I'm not sure if like, you know, I might have just said, okay, well, I'm a failure at this. Like, I can't do it. We better just go to formula only, which again, is not the worst thing in the world, but like, I'm just really glad that we've kept it up. And like, I'm proud that we're still going, you know, up to a year and hopefully beyond with that. So that's something I really credit to the program of helping us reach that goal.
Those are great examples and congratulations on that.
Yeah.
Is there anything else that you would want to share from your perspective?
Oh yeah, well, just I touched on it, but like it's been really lovely to have somebody who I can tell, like I'm a social worker also. So it's like, I can tell she's taking those notes and like checking back in with me about the things that were going on. Like, okay, how's it going? Did that front tooth finally come in, et cetera, et cetera. And it's just nice. You know, I don't have any family around. Like it's nice to have somebody who's really keeping up with us and checking in with us. And then also just like having it folded in from the beginning, I didn't even really know at first that it was like a special level of care. And then I started speaking to other friends of mine who are in other practices, you know, who are also happy with what they're doing, but they're like, oh, you have someone else who calls you? Oh, like they talk to you about this, that, and the other. And I was like, yeah, doesn't everyone? Like, that's not a normal thing. And, you know, we're just from a very like, you know, working neighborhood with, you know, which is not like super fancy, where we've lived for 11 years, where my husband is from, and, you know, was born and raised there. And like, it's nice to think that like we were getting a really high level of services in a place that wasn't some like super fancy neighborhood. You know what I mean? I work in medical social work. And so like, I'm familiar with the, you know, the different things people get. You know, some of my clients, depending on where they live, don't get very good care sometimes, or maybe it's good, but they just don't have the time or the resources to give people what they need. And like, it was really amazing to go somewhere that was 3 blocks from our house, and like, you know, with everybody just, you know, who looks like my husband and my son, and who, you know, is nearby, and we're still getting like what felt like really like premium level care. And that was really special to us. And that's why, even though we moved a little further away, we're never leaving that practice. It's so great. We love it. It's worth the cabs. Like we would never go.
Liz, thank you so much for sharing. We really appreciate you being on here, and yay for Adrian. I now have the pleasure to turn it over to Dr. Kenya Malcolm, and Kenya's going to talk about leading a HealthySteps program in practice.
I don't want to talk now. I just want to talk more to Liz and to Adrian, to be honest. I really liked hearing about all of those things. I didn't really prepare a lot for this. I've been taking notes as other people were talking, and it's been so amazing to hear so many of the core tenets of infant and early childhood mental health really coming out of what people are talking about. This idea of the opportunity that new babies provide for families and their growth, and opportunities for changes in relationships and to try something different. And relationship as context for development, I think, was really just so key in what both LJ and Liz were talking about. You know, the pediatrician being able to check in on all of these things, and that really being, or having been, the focus of appointments, not necessarily having the time or ability to talk about the relationship between a parent and the child as really that core context for how development and learning happens, and how we're able to even decrease traumatic experiences. You know, for lots of practices, they just avoid talking about things that their patients are going through that are really hard, because they know that they can't address poverty in the session. But it's relationship that really decreases the damage of those potentially traumatizing events. And pediatricians and all the other adults really can play such a big role in that. So I really appreciate all of what's already been said. And I'm a team-based care. I've drank the team-based care Kool-Aid for sure, but it's a core best practice for working with very young children, is that we're on a team with a goal of working for and on behalf of the young child, as opposed to in silos separately trying to address things that we know are just really artificially separated. So I really appreciate all the things that have been coming up, and that little Adrian is here. Before he showed up, I was like, is that baby coming? And yay, he came. So we've started implementing HealthySteps. Our go live date was 2020. So you may hear that year and remember that we started also a pandemic. So lots of the things that we started doing were remote. And in the mental health field, I think especially, we weren't sure how that was going to go, but we've gotten a lot of really great feedback from families that that connecting with people in this way that Liz was talking about can happen in really meaningful ways, even remotely. So we feel so fortunate that we were able to move forward with implementing HealthySteps, even if it wasn't the way that we thought it would be, and being able to start things in person right away. So I will also shout out SAMHSA. The reason why we're able to implement, and really why most people are able to implement programs like this and Dyadic Services, are through grants. And that's kind of what we're talking about. So we got a launch grant that is really a community focused launch grant for infants and early childhood programs across our greater Rochester area. And I'm one leg of that in implementing in one of our large pediatric practices. And the nice thing about the HealthySteps, or really team-based care models in general, because it's not exclusive to HealthySteps, but HealthySteps does a great job of really highlighting the fact that this isn't a behavioral health, like it's not just the behavioral health or socio-emotional expert or the HealthySteps specialist that needs to know this stuff. The entire team needs to know this stuff. This is how we work and serve babies and their families. So the initial training in HealthySteps is everybody in the practice, from the people who check people in, to the people that print things, to the people that provide care, social work, whoever you've got. So that's really, it's really great to have a model that recognizes that full team. And the feedback that we've really gotten from our pediatricians is we love knowing that we have people to refer to. You know, if something's coming up, the pediatric world in general has been traditionally, and I think LJ talked about how this is changing, there's a little bit of a wait and see model, you know, because something's normal at 2 years old, let's wait and see what happens and see if it becomes a problem. Versus there's something that maybe is normal, but is really annoying or really isn't working the way that you want it to, or is really distressing the family. Liz talked about the formula feeding. I remember for myself switching to formula only because I didn't know that there was gonna, like, it was either all or nothing, right? And I didn't know anything about that. And that's normal, but having somebody say, yes, that's normal, and here's something that you can do. Here's how you can feel better about that. You're doing a great job. What would you like to do? What makes sense for your family and your baby? That's a great thing to have in pediatric practices. So I'm so glad that we're able to do that as part of HealthySteps where I am, providing that care. And it's flexible in that, you know, my guess is that all 60 HealthySteps practices across New York State look at least a little bit, if not vastly different, based on the families that are in the practice and who they have providing the specific services and what their community arrangement really looks like. There's one family that just always pops out in my mind, where the mom came in and was really feeling what she reported to the PCP was, I just don't feel connected to my baby. And I saw that in the note, the PCP wrote it in as is appropriate. And I was like, you know what, I'm going to outreach to this family, because that is not an uncommon experience. But if you track in your mind how that can go over time, it doesn't end well, probably in most of our ideas, right? Or that baby who's teething, or totally normal stuff, or not rolling over quite right at 4 months, or, you know, all of those things, where that tracks with a parent who doesn't know that that's normal, or doesn't know how to self-care, or doesn't know how to ask for support. And HealthySteps really steps in to be able to help with that. So it's amazing to be part of a program like that. The other big thing that I love that Liz brought up is it's just how we do it. It's not special. You're not special. No, I'm just kidding. That the stigma associated with referrals, particularly outside of the practice, lots of people end up not getting connected to the services that they need because we have to send them someplace else. But HealthySteps has the universal component. Everybody gets screened. Everybody has access to the warm line. Everybody can ask questions. It's just how we do business. And now you're just going to talk to somebody who does this work as part of your baby's team has really helped connect with families that we might have lost contact with if we were just going to wait and see, or if we were going to ask them to go someplace else, particularly for a high needs population like at our pediatric practice. So I don't know if there were other specific kinds of things I could talk about that would be useful, but I really liked hearing the parent part.
Great. Thank you very much. And now we'll go to Donna Bradbury.
Great, thanks, Bridget, and good afternoon, everybody, and thank you so much for having me with you on this WebEx. Donna Bradbury, I'm with the New York State Office of Mental Health, and as Bridget said earlier, I'm with a fairly newly created office here at the Office of Mental Health. Last June, we kicked off the Office for Prevention and Health Initiatives, which really is indicative of the Office of Mental Health's expanding commitment to having a platform for prevention and for social determinants of health. And certainly our activity and our work and our policy work in those areas predate the creation of the office, in fact, by many years. And prior to the creation of the prevention office, I was with the Children and Families Division for 9 years. And during that time, we became deeply committed to the idea of preventing serious emotional disturbance in children. And part of that comes from my own commitment to that concept. I worked as a clinician before I came to the Office of Mental Health, and I worked primarily with a very complex population of children and youth that were involved with juvenile justice. And every time I worked with one of those kids and their families, I could see how the challenges that brought that child to the attention of the probation department did not just happen overnight. Those issues had their roots deep in that youth's early childhood and the family relationships and other stressors and traumas that had come into play many, many years before that child walked through the doors at probation. And so all that to say, myself and this office is very committed to the idea of let's get to these situations before there are serious problems that are really, really difficult to solve, even when you have really good services and really good people working on those problems. So in our efforts around prevention and infant and early childhood mental health, we look to normative settings, right? So normative meaning, where do children and their families just kind of naturally show up? Well, they don't naturally show up actually at OMH licensed programs, right? They tend not to walk into a social worker's office or a clinic, a mental health clinic, or a psychiatrist's office, right? They walk into the pediatrician's office. And they also walk into educational settings. And so our prevention work with children and their families focuses on those two settings. And it's interesting and different work for the Office of Mental Health, because then that means that we have to deal with usually providers that are not our licensed providers, which is to me really fun and interesting. And it demands that sort of cross-sector collaboration, which I find really so essential, because children and families don't just belong or go to one system, right? We have to work together as multiple systems and as a result be much more effective in meeting the needs of these families. So about 5 years ago or so, we made our first investment in the HealthySteps model. We had some money that was specifically earmarked for prevention, and we knew this was evidence-based model that was worked. And in fact, at that time, there were already some HealthySteps sites in New York State, just a few, but we wanted to add to that footprint. And so at this point, there are 13 HealthySteps sites that are funded by the Office of Mental Health. As we know, right, and we've been hearing, HealthySteps sites provide a fabulous platform for dyadic treatment. It's not the only platform, but it is a fabulous platform and one that we know works, and we've been hearing how well it works today. We also, I just want to mention too, in addition to investing in HealthySteps, we also have invested heavily in training people, again, cross-sector, in a diagnostic instrument called the DC-05 that many of you are probably familiar with. That is a tool specifically to be used when working with infants and young children. And it's important to note here, I think, because if we're going to encourage the adoption of dyadic treatment, we need to provide the people doing that treatment with the proper tools to be able to conceptualize these cases clinically, and also appropriately diagnose when that is necessary. So, and important to note, actually, that the DC-0-5 is built on this relationship concept, right? That children's behavior and their social and emotional development, as well as their physical development, right, all happens all within the context of relationship, which has been talked about here today by the other speakers. At the present moment, we're very, very blessed and fortunate to have an administration here in New York State that's extremely supportive of the work that we've been doing with HealthySteps and with prevention in general. And so we have a significant investment, and we're busy at work here at the Office of Mental Health formulating how we're going to use that investment to essentially expand the footprint of HealthySteps in New York State, and as a result, create more platforms for dyadic treatment. I also want to note that an really important, critical part of that work is not just the creation of new sites, but the ongoing collaboration and coordination with our partners at the New York State Department of Health, and also our partners at the HealthySteps National Office, at the 0 to 3 office. And so we've been collaborating with them for a number of years, and we're continuing that work with a particular focus now on how can we ultimately provide effective and accurate guidance to the field about how to bill for dyadic treatment, because we can, I think it was Dr. Malcolm who talked about, you know, a lot of this work now is funded through grants, right? And so how can we help sustain the good work that's going on now, and how can we make it more feasible for additional sites to be doing dyadic treatment? And so that's where that collaborative work comes in, working with our partners at Department of Health, where Medicaid is located, and 0 to 3 HealthySteps National Office, which has done a lot of work nationally with some other states, trying to figure out how can we take this good work and make it as sustainable as possible. So that's what we look forward to doing in the coming couple of years. And I really appreciate the opportunity to talk with you about it. And I'll hand it back to Bridget for questions and answers.
Great, thank you very much, Donna. Before we get going on Q&A, I just want to introduce Elizabeth Burnett from 0 to 3. She has been helping with us on this project, and so she's here to answer any specific questions you might have on HealthySteps if something comes up. So, hi. Before we get going on Q&A, I just want to see if the panelists want to interact with each other, if there's any comments you want to make on what you've heard from other presenters today. I want to make sure we get that. Other questions you have or comments you want to make?
I just want to call out, I appreciate hearing directly, certainly from a person who's experienced HealthySteps, from the start, and expressly from Dr. Shipley, a pediatrician, because I think, I can see how in some cases a pediatrician might say, might perceive it as an indictment of themselves. If somebody were to say, hey, have you thought about having a HealthySteps specialist, or have you thought about having some sort of a, help in your practice or for your practice? And so I appreciate hearing from you sort of saying, this is a way to really make our work better and help us serve patients. And it's we need to figure out a way to make sure that it's not perceived as, well, you're doing something wrong and here's a way to remedy it. But so thank you.
Thanks for saying that, Kate. I think that I would say we all welcome the opportunity to do even better for the kids and families that we serve. I think one of the hardest things is, and I will bring it back around, Donna spoke about where's the sustainability in this space. And I think that, I'm excited about these things that are in the budget that you spoke to and that Bridget spoke to, and the opportunity to move in a direction. But I think there's other opportunities, and I don't know if it's appropriate to say here, but I'm happy to state, when you look at the Medicaid 115 waiver, the proposed waiver, if that is a way that we are going to actually change the way that Medicaid supports our efforts and improves health in our community, the fact that there is no focus on programs like this, focus on pregnant women and infants and children, I think we're really missing a critical moment here. And I hope that in this comment period, we have an opportunity to forward that, because we're not going to change. If everything is reactive and downstream, you never get ahead of the game. And this is the space in prevention and working with pregnant women, with children, with families. This is where we can make that difference. And so I just hope that it feels to me like New York is looking for a way to make change, but there are other states that are going way faster and farther than we are. And it would be awesome if we caught up and went beyond what they're doing. So I just hope that there's space for that.
Hear, hear.
I think I want to expand upon that a little bit. Dr. Shipley, you mentioned the need to make connections to programs such as home visiting. And I wonder if you and Dr. Malcolm and even Donna might talk a little bit about where some of those other system connections need to be, and how we need to be funding or thinking about bringing those other systems into the funding streams or services to connect them more directly to a program like HealthySteps. I don't know if you want to talk about any work that you're doing in your own communities on this.
Ken, did you want a chance to go first, or I can step in first?
You can step in first.
I think Bridget, when we look at the continuum of services, and we look at it across, I love what Donna pointed out. Like, I'm a pediatrician, so I tend to come into something thinking everything that I do is critically important for a child and family, and it is important, but that's not, they don't live in my office, right, Liz? Like, you don't spend most of your time in our office. And so making sure that we're thinking about what are the services that will really engage families in their communities, home services, community resources, schools, childcare centers, unless we really are thinking across the continuum of where a child and family spend their time, we're going to do a great job in the space we occupy, but we're still not going to get there. And so as an example, in Rochester, I know and have the opportunity to consult with a team that's doing a care management model within a women's health practice. It's gender wellness OBGYN practice at UR Medicine. And as part of that, they do initial screening for families. And out of that, they're immediately referring any pregnant women who's identified who would qualify for services like nurse family partnership or building healthy children or other evidence-based effective programs that require some more intensive services. But at the same time, they're looking and identifying families who might need resource support for tobacco cessation, or they may be working with a woman who's identified as having anxiety or depression and working on that with their behavioral health team early. And so there's this movement in and out of the practice setting and connecting to resources in the community and working across all of the disciplines. And then we see the same sort of need to transition that care very thoughtfully once the baby is born, because even though we're all working on the same team, there's like there's a divide between OB care and pediatric. It's not because we don't want to work together, but our systems are set up that way. So looking at universal newborn home visitation models that really look at that bridging, or care management transition models that do bridging around that time, I think are really good spaces. And the last thing I would just mention is we have the experience in Rochester of having a very robust, comprehensive developmental, social, emotional, social determinants of health screening program called GROW. GROW Rochester is a wonderful addition and partner and an add to having a HealthySteps model in a practice. And so Kenya's had some experience in working with GROW and with the HealthySteps program. We're looking to see how do we bridge the comprehensive developmental screenings that are happening for kids in the community and those that are happening in practice. How do we partner together? Because otherwise children and families fall through the cracks, and we need to make sure that they do not.
I think the thing that comes up too, as we're talking about this, is one, that there's often overlap in services. And that sometimes the approach from folks is to throw as many services at a family as possible without really thinking about which services are being duplicated and who's sort of helping to manage all of the things that are happening. So that's one thought that comes to mind, which makes me also think about the fact that not all of those services would even count as billable services, right? Like it's the array of management that needs to happen isn't just direct intervention or even only with the provider and the baby and the family. Sometimes it's provider to provider. And I don't know that there's any way to figure out how to do you guys get to figure out all of those things. And so when we think about, especially in the practice where I am, and we are a resource rich area, sometimes what it means is the HealthySteps person being tagged in from the PCP and learning that the family's already connected to building healthy children, for example. And so then the role of that HealthySteps specialist might look a little bit different with that family, checking in or making sure that they're coming to their appointment, but not necessarily providing that overlapping service that the Building Healthy Children case manager is doing, right? Or if they already are talking with a lactation person as part of the universal home visitation program, then we wouldn't be providing that part, but we can help make the connections between how does that fit in with what this person might be talking about? Where are some of those gaps? So I think that sometimes it feels like if we just throw all the things, something will stick. And what I find, particularly for very poor families, they've got so many people calling them and telling them what to do and telling them where they're supposed to be that they just don't answer the phone anymore. And that's not a good way to coordinate care. So those are the kinds of things that come up as we're thinking about all of these different kinds of things and roles that it's not just about that direct dyadic service either, right? Like we're also talking about these other pieces that go along with providing that care.
Well,
You got that right. It's sorry, Bridget, it's coordination and it's consistency, right? In care, that is really key. But it's how does that get paid for? like you have to have some sort of value-based payment strategy or bundle payment or something that changes the way that those services can be consistently delivered. Because otherwise it will always be grant funded. And that will mean that most of our practices will not be able to implement or sustain something.
That's a great point to end the conversation on. There's so much more to talk about here. I got a whole list of things that we're not going to get to today. So hopefully we can continue this conversation soon. I am going to just hop back in here quickly. So just by way of summary for today, you'll notice that along with the background materials, Shannon's just dropped back in the chat room. There's also a quick survey we hope that you take. If you take a moment to complete the survey, it'll help us not only with the evaluation of the webinar, but it'll allow you to indicate if you would like to be connected to future webinars, conversations, and efforts to expand Dyadic services. We'd love to have you on a mailing list. I'd like to thank our panelists today for sharing their expertise and their thoughts on the impact of Dyadic services for families. It's fair to say that we've all learned about the importance of expanding these services, and we have some good ideas about some next steps that we can be taking. So a recording and the slides will be sent by email, and they'll also be available tomorrow on our website. And we hope that you forward the links to your colleagues and friends. And so there's our contact if you want any additional information. And again, thank you to all our panelists, including Adrian, for joining us today on the webinar. Thank you.